7:34. My guest is on the telephone today. It's Shona Holmes, who's considered a Canadian healthcare refugee. Good morning, ma'am. How are you?
Good morning. Thank you so much for having me.
It's my pleasure. I'm going to get right to the gist of the program here. You fled Canada to come in the United States. Now, the United States is doing what Canada has done. I want you to just take a few minutes and explain your situation and your story to our listeners, because probably the vast majority of the listeners are anti what we call Obamacare or the Affordable Health Care Act. So I want you to tell your story real quick, and we'll discuss this.
Absolutely. What happened to me is I started to get some really odd symptoms, and the most troublesome to me was I started to lose my vision. And I contacted my optometrist, which is one of these doctors that still isn't covered under the government-run health care, so I was able to get an appointment right away. And he could tell by my pattern of vision loss that I had something that was pressing on my optic nerves. And he told me not to panic, but to get in to see my family doctor right away. And again, there was still no panic because I'm one of these very fortunate Canadians that actually have a family doctor. And I went to see my family doctor, and that's when the nightmare began, because I was looking at a 9-week wait for an MRI and 4 months to see one specialist and 6 months to see another specialist. And then that's when I realized how bad the Canadian system had gotten under government-run health care. And so I picked up the phone, called an American hospital. I was able to get in right away, have all my tests done within a week, full diagnosis. And the funny part of my story is actually the first 2 doctors I saw in the United States were actually Canadian doctors that were now practicing in the U.S. And so they worked tirelessly to try and get me care back home, because I had been diagnosed with a brain tumor, and they felt that it was in my best interest to be near my family. And obviously, why pay for something when you have insurance, which is what I had at home, run by the government, and they couldn't get me into anyone. And so I ended up returning back to the United States and having my surgery. And I have not stopped talking about it ever since.
Now, did this take place around the Detroit area? Did you come into Detroit? What part of Canada?
I'm actually just outside of Toronto, but I ended up going to the Mayo Clinic in Arizona. And the thing was I really didn't know any hospitals. I mean, as a Canadian, you just don't know how to source this sort of stuff for yourself. And Mayo only by name is what I knew, and so that's where I called and ended up. So I was very blessed to have the experience that I had, and then it just became so important to me to speak out and let Americans know how dangerous the road is to government-run health care.
And I notice right now you're a constitutional challenger in a case to give citizens the right to purchase private health insurance in Canada.
Exactly.
What we call a lobbyist here.
That's it. Can you absolutely imagine not being allowed by law to use your own resources in any shape or form in order to take care of yourself? I can get an MRI for my dog tomorrow, but I can't get anything for myself. And to give an update on my story is I've started to have repeat of symptoms. And so it's been advised that I need to get another MRI in order to see whether or not the brain tumor has returned. And my wait time now is 5 months and 20 days to get in for an MRI.
Say that again?
5 months and 20 days. It was ordered on January 7th, and my MRI date is June 26th.
Unbelievable.
For an MRI. And that is somebody with a history of brain tumor and surgery, and I cannot get it any sooner. So this is what, when your president is out there telling everybody that it will get better, that when all the fuss dies down and things will get better, that you'll get easier access to mammograms and colonoscopies and all those things that will help you with your health, it is not true. It will not happen. Because what happens is, like everybody thinks with us, we've got a shortage of equipment, we've got a shortage of doctors, but we don't. What happens is the government determines how much we're allowed and how much they're allowed each hospital to spend, how much operating time a doctor is allowed in a week. And so you just go in a lineup. But the hospital budgets are not allowed to go over, and so we become victims of it.
So basically everything is just by the government and strictly the government.
Exactly. And the thing is what is deemed as health care for Americans versus Canadians is very different, because Canadians have no coverage for things like dental or drugs or rehabilitative services, anything like that. You have to pay out of pocket. And an average family of 4 in Canada, through their taxes, pays about $15,000 a year for their health care, quote-unquote free health care. And like I said, you are looking at devastating wait times for people. And it's very, very sad. When I first started speaking out, about 40,000 Canadians a year came over the border for treatment. It's now gone up to 57,000 last year. And I don't know where Americans will go. And this is why I am so vocal about it, because I know we won't be able to reciprocate and help Americans the way they've been able to help us.
My goodness. It's unbelievable, some of the stuff that you're saying.
Yes, it
But
will.
we're getting ready to face the very same factors if we're not careful and get this stuff repealed.
Absolutely, and repeal is really the only way that you can go. Definitely, both of our systems needed work. There's no question about it. But what, for me as a Canadian, watching, I was able to come over and be treated like a consumer, and I liked that because I became, the purchaser of a product. Whereas in Canada, you are literally just a number, and you can see people wait up to 3 years in order to get surgery for something that's not life-threatening. And unless you're wheeled into an emergency room and right on the operating table, you will face wait times. And whether or not the government deems that wait time is long enough or not long enough, that's what unfortunately you're facing. And like I said, I just felt that it's so important that Americans understand how bad the system has gotten.
What I don't understand, Ms. Holmes, is why do government people think it's better when they're in control, when, especially in the United States, maybe every 2, 4, 6, 8 years or so, we're changing leadership.
Right.
And, we've got it, we have to live with it. No, we don't. We, the people, can take a stand. We can lobby like you're doing against it, and I hope you're successful in Canada, because I think you need to be able to purchase your own privately funded health insurance. And for us, we're in the state of Arkansas, which is about 250 miles southwest of St. Louis, Missouri, and here I am on what we call the state line, 15 miles south of the state line of Missouri, and I can't go to Missouri by health insurance. I have to buy it in Arkansas. So why can't we go across? I can go across the state line by gasoline or groceries, but I can't do health insurance that way.
Absolutely.
And so, the government said, we're going to do it this way, it's going to be so much better. Let the people do what we do best, live our lives by ourselves without government interference.
And the thing is that unfortunately, I was even one of these people that thought the Americans had a terrible system. Because the world looks on America to get it right. And this is why it's so important for me, because people will learn, because Americans do know how to do things right when they stand up and say, we're not going to take this anymore, and action gets moved towards something. But how we look at it is that unless you get involved in the fight, then they will completely take it over. And it sounds really nice. Isn't it great that we don't have to worry about health insurance? But this is all. Obamacare has strictly been about insurance. It has nothing to do with health care. It will not improve your care. It will not improve your services. And this is why it's so important.
Back in January, of course, in the cold weather, we had a few allergy symptoms. We had some colds and sore throats, what have you. And one of the men here says, I suggest we go see a doctor and get cleared up, because, when you're in a radio station in a small room, you just pass around. So I thought, okay, that's good advice. Went to a local clinic. My copay was $20. I got in within 20 minutes of stopping by.
Wow.
Paid my $20, got my meds, and in 3 days I was fine. Do you have that type of situation in Canada?
Absolutely not. And like I said, I live in a city, a medium-sized city, and there are 33,000 people without a family doctor. So how do they get health care? They rely on the emergency room. And I'm sure that sounds familiar to people in the United States. Now, some people are lucky. They can get in for a cold, that sort of thing. They can get in quickly. Some have to wait 3 weeks before their doctor will have an opening for something, and then they have to rely on a walk-in clinic. So that sort of stuff, yes, we can get treated within a fairly decent amount of time. But when the push comes to shove and you actually need something, then it's an outrageous amount of wait time.
So now, how are you lobbying for the right to purchase private health insurance? Where do you start in Canada? You've got all the provinces. Do you go to British Columbia, Saskatchewan, and
Great question. Yes, excellent question. We have to win the case in each province.
Really?
So the case was already won in the province of Quebec, and right now the next case that's going before the Supreme Court is in British Columbia. And we have a case right now that's before the court, and it's a 15-year-old boy who had such a severe curvature of the spine, and he was 2 years on a wait list for surgery when his parents finally said that we can't wait any longer, took him to the United States where he had his surgery, but he is now permanently disabled. He will never, ever walk again, and that is strictly because of the wait and the delay in the surgery. So they're fighting it on behalf of this child. And unfortunately, there are so many child-related cases in our challenges, and this is what's so tragic. I mean, I was an adult and could speak for myself, but, the vulnerable, the seniors and the young children are the ones that are really, really suffering. And, so that's what we're doing. So I'm the challenger for the province of Ontario, and hopefully we'll be successful. But it's a long battle. I mean, my case has been before the court over 7 years. So it's a very,
7 years before the courts.
Yeah,
Wow.
very, very. And, I'm $100,000 that my husband paid towards my medical bills here in the United States, over and above what my health insurance was supposed to cover in Canada. Well, then you got to look into legal costs. I'm fortunate that I'm with an organization that has taken up the case, but, people can't afford this.
Yeah.
And they can't even afford it emotionally, because when you're fighting for your life, the last thing you want is a battle. And you think it's difficult to fight with an insurance company. Wait till you have to fight with the government.
Yeah. We do that every year. It's called the IRS.
That's right. And they're real kind.
And they listen really well.
They do. And you'll hear more on one occasion. We don't look at individual cases. Well, you know what? It's our health care, and it is an individual problem. When you're sick, you don't realize how bad a wait time is until you're in pain, and then that's when it really boils down.
We're starting to run close on time. I want to get your final thoughts here.
Okay. Well, like I said, my biggest message to all Americans is to realize what you had and what you have now, and to stand up and fight against this, because it's really, really important. The time is now before it's too late, because we're 40 years into it, and ours is just self-imploding.
Well, I wish you the best in your fight to get the rights for Canadian private health insurance there. And I appreciate your time today and for informing us what's going on. Shona Holmes, and do you live now? Are you still living in Canada? Or you have?
I certainly am. I certainly am, with all my family, but it's still a battle for us. So,
well, appreciate your time today, and we'd like to have you back on sometime.
Thank you. I really appreciate it.
Thank you, ma'am. Thank you so much.
Bye-bye.
Time for the Sean Hannity Daily Update. We'll be right back. It's almost 7:54 on a cloudy morning. We'll take another quick look at the radar here as soon as I hit the right button and refresh it a little bit. We have shower activity mainly in Oklahoma right now, moving into northwest Arkansas, southwest Missouri. Well, the showers are already there in southwest Missouri. They're stretching basically from Joplin to St. Louis, all the way to Chicago, into northern Indiana, Michigan, Wisconsin, southeast Wisconsin. It's going to be a rainy day, possibly a rainy week, but that's how it is in April. A few things to let you know about here before we end the program today. Come see The Sound of Music, a Christian adaptation, Saturday, April 25th at 7 p.m. and Sunday, April 26th at 2 p.m., performed at Dunbar at the Mountain High School campus. This is the Home-Style Christian Educators Program. Enjoy seeing 45 homeschooled and Mountain Home Christian Academy students present this special musical with costumes, drama, and choreography. The Sound of Music musical is free. Donations are accepted. Everyone is welcome to attend. Takes place April 25th and 26th at 7 o'clock on the 25th and Sunday at 2 o'clock. Then a couple opportunities to help your volunteer fire departments. The first one's this Saturday. The Cotter Gassville Rural Fire Department is hosting their annual barbecue and auction Saturday, April 18th at the fire station at Denton Ferry Road at Wildcat River Access. Come enjoy great food and music by Rio. It's 11 a.m. to 3 p.m. And for more information, call Vern Beeman at 430-2007. Buford Volunteer Fire Department is having their spaghetti fundraiser. This is on the 26th. That'll be a Sunday, the last Sunday of April. And from 11 to 2 at the Buford Community Center at 4439 Buford Road. $7.50 for adults. Children 6 to 12 is $3.55 and under, eat free. This includes spaghetti, salad, bread, cookies, beverage. That's from 11 to 2 on the 26th of April. And see if there's anything else we need to cover. I think that's got us there. Once again, we'll take another quick look at the radar. We got shower activity stretching from New Mexico, Texas, Oklahoma, Louisiana, Arkansas, Missouri. It's just now starting to get into Arkansas, and then it's just unbelievable on this radar. South Louisiana, around that'd be Port Arthur, Texas area, southwest Louisiana. Heavy showers down there in the Gulf of Mexico. Showers in the panhandle of Florida to southwest Georgia into central Alabama, northeast Mississippi. And then, again, the shower activity stretches from basically Green Bay, Wisconsin, down through Milwaukee, Chicago, into Gary, Indiana, and across Springfield, Illinois, central Illinois, into St. Louis. Hope that don't affect opening day at Busch Stadium today. Anyway, that pretty well wraps up the program. And don't forget, audio on demand. You go to mountainradio.com, look for AOD for audio on demand. You can hear any of the programs we put on there. And that pretty well wraps it up for the day. We'll be back tomorrow. Right now it's the Rush Morning Update, followed by Glenn Beck. We'll see you tomorrow.